Over the last few decades, providers have undertaken a number of strategic alliances, including forming clinically integrated networks, or what we refer to them as CINs, to help coordinate the delivery of healthcare services across the continuum of care for a defined patient population, in accordance with certain cost and quality and utilization measures. And really the basic idea behind clinical integration is that providers in a network work together in a coordinated and collaborative manner so that really the whole of the network is greater than the sum of its individual parts in delivering quality care to patients. I think telehealth fits really nicely into what clinically integrated networks are designed to do, in the sense that telehealth allows for a more modern and efficient way for providers to connect with their patients and monitor their overall care by taking what could have been a visit to a primary care provider's office or an urgent care clinic and making it a convenient video chat from a patient's home, thereby reducing the healthcare spend from both the patient and the payer perspective. And one of the goals of a clinically integrated network is to reduce healthcare spend in a legally compliant manner for the benefit of the patient without sacrificing quality of care. And so there are ways that clinically integrated networks can incentivize their providers to do these kinds of things. So in order to receive incentive compensation, providers in clinically integrated networks are held to certain standards and metrics like efficiency and patient satisfaction measures. And, I can certainly envision scenarios where providers utilize telehealth technologies in a way to accomplish these kinds of metrics. I mean, what is more efficient and satisfying to a patient than getting on the phone or video with your provider in a matter of minutes? Any use of a clinically integrated network requires careful attention to a number of regulatory issues, including antitrust and healthcare regulatory and HIPAA and data privacy. And I think the use of telehealth only adds some additional considerations, particularly as we're seeing clinically integrated networks expand into sort of multiple geographies and, multi-state or regional clinically integrated networks. So you're thinking about issues like your physician licensure and corporate practice of medicine and some other similar considerations in these kinds of multi-state regional clinical integration arrangements. It's very common for us to have these multi-office and multi-practice teams together working for the benefit of our single client, because clinically integrated networks are complicated. Arrangements in the healthcare industry are complicated, and they require legal attention from a number of different legal disciplines. And so we're able to pull in these subject matter experts who have familiarity with these kinds of issues in order to best advise our clinically integrated network and healthcare provider clients.